Clinical guidelines change constantly. A model trained on last year's data provides outdated recommendations, which, even if the doctors can identify with some effort, patients won't be able to do so. SentryLine is grounded in a living version guideline corpus, and every answer goes through retrieval, generation, and independent fact checking. Now, let us look at an example of negative breast cancer patients. The question is 2025 ASCO said evidence was insufficient to routinely add ICIs in early stage TNBC. What is the 2022 update? Once the answer is retrieved, the evidence sources cited in the conversation will appear on the panel on the left. And when we view the PDF, the paragraph in which the answer was grounded in gets highlighted. This can be used by the clinician to verify the answer, verify its evidence, either accept the answer, review it, and change it, or save it as it is. So once it is saved to the cache, next time somebody asks a similar question, SentryLine answers instantly without rerunning the full pipeline. Now let us ask few follow-up questions. So the follow-up question is, when did ASCO issue the update and what evidence prompted the change? Each turn the system checks whether it's using the correct guideline version to answer. When the answer is partially verified, the clinician can manually go through the answer and either correct it or update it and then save the answer. We also have previous conversations saved in the conversation history on the left panel. See that there's a document outside our available guidelines corpus, and instead of hallucinating, it points out that the standard document is not provided in the available guidelines. So now the clinician can either use their own reasoning and verify this report, or they can edit and provide corrections. Now let us see, if we ask the same question in the patient-facing panel, what sort of answer we can expect. I have changed the role from doctor to patient. We can see that there's same guideline, same evidence, but the answer is in plain language with no clinician jargon.